Okay, Mr. Jenkins, now I'd like to start asking some questions so that I can understand a little bit more about what's going on with the systems in your body. Is that okay with you?
Yep.
All right, great. So I'm gonna wanna be looking at your feet, so would you mind taking off your shoes for me?
Sure.
All right, and while you're doing that, I'm just gonna ask some questions. Have you had any unexplained weight loss or gain recently?
No.
Any fever, chills, or sweating?
Nope.
Nausea, vomiting, or loss of appetite?
Nope.
Yeah, I got this.
Dizziness, lightheadedness, or falls?
No.
Fatigue, weakness, numbing?
Wait, time out.
Alright, so now I want to take your heart rate, so if you wouldn't mind just flipping your wrist over for me. Great, and do you mind taking that watch
That's
off?
fine.
Alright, so I'm just going to place my fingers here, and it'll be a minute without me talking, just because I want to hear or feel your heartbeat. Okay, Mr. Jenkins, your heart rate was 68 beats per minute and your respiratory rate was 16 breaths per minute, so those are both good numbers.
Okay.
Okay, so have you noticed any edema or swelling in your body at all?
Sometimes my feet are kind of big after standing for a while.
Okay. Have you been standing much today? Because it doesn't look swollen to me.
Not too much.
Okay. All right. Okay, so now I want to analyze your skin. So this is called your integument system. So just some overview questions. Have you had any rashes or other skin changes that you've noticed?
No.
Any new or changing moles?
No.
Sores that aren't healing? Any changes in your nail beds?
No.
Okay. All right, so now I just want to look at the skin surrounding your right knee. So overall, the pliability and texture looks really good. It's not too tight or too loose or anything like that. And I do see a scar right here that must be from your meniscectomy.
Yeah.
Okay, and that all looks good. The skin color, again, looks really good, really similar to your other knee, so that's a good sign, and no lesions or cuts on it. All right, so now I want to analyze the strength and range of motion in your muscles. So again, just some questions. Have you had any joint pain, swelling, or stiffness aside from your right knee?
Not anything in additional to the knee.
Okay, any muscle wasting or weakness?
No.
Okay, pain that never changes?
No.
Okay, so your upper body, totally fine, no complaints?
Yep.
All right, great. So now I just want to start by looking at your hip, and I'll actually be looking at your ankle in addition to your knee. So first, can you mirror me? So just lift your leg up. Good. Let me know if there's any pain with any of these. Bring it behind you. Good. And the other side. Good. All right, and now can you out and bring it back in? Out and bring it back in. All right, and now I want you to take like the inside of your foot and bring it in, but the motion occurring at your hip. Good. And can you go out? Same thing on the other side. Good. So that all looks good to me. And now on your left knee, can you kick it straight out and bring it back in? Any pain?
Nope.
And let's try that on the right. Again, let me know if there's any issues.
It's painful.
Okay. Okay, Mr. Jenkins, now I want to take a look at the strength of your muscles. So we're going to do the same motions that we did looking at the range of motion that you had, now just assessing the strength. So we're going to start with your hip. If you want to lift it up like you did before, good. And now I'm going to try and push down and you resist me.
Okay.
Good. All right, and now you try and pull down towards the floor, and I'm going to hold you here. Good. All right, and now can you try and bring your leg out like this? Good. All right. Good, and now you'll bring it back into your body. Good. And now we're going to do those rotation movements. Good, and the other side. Good. All right, right, now if you can kick your knee out like this, good. You can relax just a little bit. Now you try and kick up, and I'm gonna hold you here. Good. Now you try and pull your heel back. Good. Now we're gonna take a look at the ankle. So would you be comfortable putting your leg up and resting it on
sure.
mine? All right, good. So now try and bring your toes up, and I'm gonna push down. Good, and now you try and push into my hand. Very good strength. Bring it in. Look at the strength on this side, so we're gonna do all those same motions. So first, if you wanna lift your leg up, good, try and push down, and I'm gonna resist. Good, and now you try and push up against my hand.
Okay.
Good. And now, if you want to abduct your leg, move it out like that. Good. And I'm going to try and push you in. Good. And now you bring your hand in, or your leg in against my hand.
Okay.
Good. Now we're going to do those rotations again. So if you want to bring your foot in, good. And I'm going to try and push it out. Good. Now the other side. Good. So now I do want to take a look at your knee, but if anything is too painful, we'll definitely stop.
Okay.
So first, try and kick your knee out like you did before. Good. That's as far as you can go without pain?
Yeah.
Okay, so I'm gonna try and push down.
That's pretty painful.
Okay. Then we'll take a look at your knee flexion and extension. That's these movements later in the test for a formal evaluation. But while we're here, we can still take a look at the ankle as long as that's not causing you pain.
Okay.
So again, are you comfortable putting it up on my leg?
Yep.
Right. So now try and bring your toes up to your nose, and I'm gonna resist. Good. And now push them against my hand. Good. And now bring it in. Good. Last one out. Good. Okay, we're on our last section. So this is looking at your neuromuscular. So a lot of the things that we're going to be looking at are going to be related to balance and coordination. So again, with the questions, have you had any coordination or balance problems lately? I know you said in the barn with the uneven surface.
Yeah, that's pretty much it.
Okay. Any changes in vision or hearing?
No.
Involuntary movements or tremors?
No.
And any severe headaches?
No.
Okay. So, Mr. Jenkins, how did you get here today? I know you're driving. Did you?
Yeah, I
drove
drove here and
Okay.
I walked in.
Okay. No problems with that?
No.
Okay, good. All right. So, just sitting here, you look like you're doing really well, but just for safety purposes, would you mind picking this pencil off the ground just to test for balance? Good, and that looks really good. So because you are having some problems just moving about with balance issues, I just want to be careful. So I want to do a few more tests, but in order to be safe, would you mind if I put this gait belt on you?
That's fine.
Okay. All right, so if you want to lift your arms up for me. We want this to be pretty snug. How's that feel?
Good.
Good. All right. Tuck this excess in there. All right, and now would you mind standing for me?
Mm-hmm.
All right. I'm just going to tighten this a little bit more. Good. All right. So I'm just going to ask you a few questions while we're standing here.
Okay.
So, or on and off of the toilet, anything like that?
No.
Okay. And again, upper extremity is doing well, and we've looked at your lower extremity, so that's all good. Now, while you're standing here, I just want to test the same thing that we did in the chair, where you picked this off the ground. Would you mind grabbing that for me? Okay, so that looks a little impaired. Okay, Mr. Jenkins, for our last test today, I just want to look at how well you're able to walk. I know you've been doing it a lot lately, but I just want to make sure that everything's okay. So I'm going to stand on your right side since that's where you're having most of your problems with your knee. So first we can just walk over to this open space, and I'll just be here if you need me. All right, good. So now if you wouldn't mind walking straight ahead towards the wall for me. All right, great. It looks looks like you're doing well with that.